Health Spotlight, presented by Community Health Network.
Well, a cancer diagnosis is tough for anyone to hear, especially in a child or a teen.
And when it comes to funding cutting-edge research, it's a challenge to help cancer's youngest patients. News 8's Lena Pringle has the details.
The federal government has almost $7 billion earmarked for cancer research in this year's budget. That's the good news. But think about this. Every year, only a small portion of that money goes to childhood cancer. What does that mean for the youngest patients, their families, and the doctors who care for them? A 14-year-old Janalee Besseril was on her first ever vacation to Orlando when a nagging sore throat became unbearable.
That whole week, we were supposed to go to Disney, Universal, a whole bunch of wonderful, wonderful parks, but I never got to go.
Janalee was hospitalized. Her blood work came back showing very low white blood cell counts.
She has B-cell acute lymphoblastic leukemia. It was very, very overwhelming.
At first, you cry a lot, like a bucket full. Like 2 million gallons full.
Janalee was transferred to a hospital near her New Jersey home and began immediate cancer treatments. But for pediatric oncologists, the federal dollars to support cutting-edge research aren't always enough. Only 4% of the cancer research budget goes to kids' cancer.
There just really isn't the funding that we need to conduct the research and find better treatments for our kids.
At major U.S. pediatric cancer centers, research is often largely funded by public and private fundraising. At the Joseph N. Sanziri Pediatric Hospital, where Janalee gets treatment, Tackle Kids Cancer, and a partnership with football great Eli Manning, funds new clinical trials and programs to provide much-needed support to families like Janalee's.
How I think is that God gave me this sickness, knowing I can beat it.
At Dana-Farber Boston Children's Cancer Center, the Jimmy Fund has raised millions since 1948. Tackle Kids Cancer has raised $20 million since its inception in 2015. Dr. Hansen says the good news about pediatric cancer is that it's relatively rare. But as a result, federal funding is usually channeled to other more common adult cancers. I'm Lena Pringle for Wish TV at wishtv.com.